everybody, this is Nadine Groskowiak, also known as the Gluten Free RN. Join me today as we discuss celiac disease and all of the other autoimmune issues that are associated with it. If celiac disease is an autoimmune disease, and we apparently know the trigger for that, which is gluten or the gliadin protein, then we have to look at all of the other autoimmune diseases associated with celiac disease. We're going to do that today in episode 10 of the Gluten Free RN podcast. Thank you for joining me, and let's get started soon. Hi, this is Nadine, the Gluten Free RN. Today we're going to talk about celiac disease and all of the other autoimmune diseases associated with celiac disease. Once you have one autoimmune disease, your chance of developing another one is 30 to 50% greater. Why is that? What's going on with our bodies, and why is our body attacking itself? Is that a good idea? Actually, that's a very bad idea. So today we're going to tackle this large topic, and then over time what we'll do is look at every individual autoimmune issue and talk about the association with food and how our immune systems actually get triggered both innately and adaptively, so that our bodies start to look at ourselves, our very own body, as an enemy or as a problem that has to be knocked out. And believe it or not, autoimmune diseases can and will kill us, which is a bad idea. So it's not ever good to be at war with yourself or have your body at war with itself. And just another opportunity for a huge shout out to Pulse Media Network and thanking them for actually making this podcast possible. And also a thank you to Tim Holloway, the podcasting guy, for being my executive producer and editor for Gluten Free RN. Today we have a large, broad topic focusing on celiac disease and all other associated immune diseases or issues. And this is an interesting topic, as far as I'm concerned, of course, because I actually had 7 autoimmune diseases. I know that's a lot. And so I'm always encouraging people to collect something other than autoimmune diseases, things like Beanie Babies or hair ties or whatever it is that you like to collect. Collect rocks for all intents and purposes. But do not, if you can help it, collect autoimmune diseases. And once you recognize that you do have an autoimmune disease, it's a really good idea to really seriously think about changing your diet, because food is medicine and it has a huge impact on our bodies. Of course, it's what we eat. Food gives us energy, but it also can be either extremely healing or it can be a poison for our body. And so we want to remove the things that can either be pro-inflammatory or that our body reads as a poison. As I mentioned, I had 7 autoimmune diseases. I had Raynaud's, which is a interesting thing that makes your hands either purple or white. Hands and feet, actually. And so my hands and my feet were always purple or white. Didn't have very good circulation. I always had to wear thick wool socks, and sometimes I had to put gloves on before I went to bed. I was always cold, and Raynaud's is a circulation issue. Autoimmune disease that can make your hands and your feet very cold and decreases the circulation. I also had Sjogren's, which starts off very interestingly by making your mucous membranes drier. So my eyes were dry, my contacts, I had to take them out. I was always putting saline solution into my eyes because my contacts were dry. My mouth was dry. And like I said, every mucous membrane. So guess what? Vaginal dryness, which is considered to be just a thing that us women have to put up with. But when you put all those things together, those are early symptoms of Sjogren's disease. Now, it doesn't stop with your mucous membranes drying out. It actually causes your organs to turn into rocks because everything dries out. So that again will kill you over time, and it's not a very good way to die. So again, I encourage people to avoid these if at all possible. And if you have them, just know that potentially you can undo the damage. Your body does want to get better, and we'll talk about how to do that. So Raynaud, Sjogren's, rheumatoid arthritis, osteoarthritis, there's lots of arthritises that are associated autoimmune diseases. Joint pain. Some people just have joint pain. My hair was falling out and getting thinner. And thankfully I have really thick hair, but I definitely could tell that my hair was getting thinner. And I actually had some of those bald patches that can happen on your head. I didn't like that very much. It's not a very good beauty plan. And so some people have alopecia areata is what that's called formally as an autoimmune disease. It's where your hair falls out. And I see a lot of people, men and women, with alopecia areata. And some people just assume they're supposed to be bald because it runs in their family. But if they actually have celiac disease and the celiac disease is triggering the alopecia areata or the hair falling out, then potentially you can undo that damage. You don't have to have hair plugs for men. You could actually maybe just change your diet, correct the deficiencies such as zinc that are causing your hair to fall out, and potentially you can end up with a full head of hair again. MS, which is multiple sclerosis, we have a lot of patients that actually get misdiagnosed with MS or ALS or Parkinson's disease, that if they're screened for celiac disease, sometimes it comes back that they're actually positive for celiac disease. They change their diet and their nervous system will heal. It does take longer, but believe it or not, your entire body wants to heal, including your nervous system. So if you've ever heard that your nervous system cannot heal, I would argue that point, and I believe so would Dr. Terry Walls, who was diagnosed with MS, changed her diet, went on a paleo diet, and actually went from being immobile in a wheelchair to riding her bike again. So her book is called The Walls Protocol, and it's WAHLS. If you know anybody that is diagnosed with MS or is getting treatment for MS, really suggest to them that they read her book, because it is quite powerful that she went from a wheelchair and incapacitated to, again, riding her bike and walking without a cane. Much better. And she is actually doing a clinical study on changing people's diets and seeing how they improve. So if you want to be a part of that study, I'm not quite sure if it's still going on, but I know that last year or the year before, she had actually been instituting that study. Might even be getting ready to be reported. So stay tuned and look into any information that Dr. Terry Walls has for you. I had already been on a gluten-free, dairy-free diet, soy-free. After 4 or 5 years on that diet, I got my lab work checked by a doctor just to find out how I was doing, how my labs were, my vitamin D level and whatnot. So at that point, my vitamin D level was still low. I think anything below 40 is critically low. So mine was only, 43. My B12 was low. It was in the 300s. I don't like that either. And then I still had a positive ANA, which really was disturbing to me because I thought all of my autoimmune diseases were gone. At this point, I was already running marathons and felt much better. And because my symptoms were gone of joint pain and Raynaud's, my hands were definitely not getting as purple or white as they had been. My Sjogren's had resolved. I thought, I was completely better. But the lab work came with this positive ANA or anti-nucleotide antibody that showed that I still had active autoimmune diseases. So I thought, what do I do? Well, the doctor suggested I go see a rheumatologist, and she said, you better call quickly because they're busy and you want to get in there. It's going to take a long time. And I said, why is the rheumatologist so busy? And she said, because there's so many people with autoimmune diseases. My nurse brain said, why are there so many people with autoimmune diseases? Of course, what we know is that the younger people are, when they get diagnosed with celiac disease, the less risk of developing other autoimmune diseases. So that is the push to find people early. Hopefully identify women before they get pregnant, but if not so, then identify the children really quickly before some of the autoimmune issues are already triggered, such as type 1 diabetes. So this positive ANA test didn't actually prompt me to go see a rheumatologist. It actually prompted me to go on a paleo diet, which I did for a year. And at the end of the year, I went back to the doctor's office for repeat labs. And lo and behold, my vitamin D level was between 60 and 100, which is where I and oncologists like to see it. And my B12 level was much higher in the 800s, 900s, which told me that I was actually absorbing those things. And my ANA panel came back negative. Now, most doctors will tell you that ANA panel, once it's positive, will never come back negative. But here, right in front of my doctor, was a negative ANA test. And she said, "What did you do? This never happens. How did you do it?" And I said, all I did was change my diet. All I did was go on a strict paleo diet for a year. And lo and behold, my ANA is negative. Woohoo! So I was very excited about that. And I wrote about that story in my book called Donation, DOUGH Nation. And you can find that book on Amazon.com and my website, glutenfreern.com. It's at every bookstore, and your library should actually have it. If they don't, please ask them to order it. Lots of good stories in that book, by the way, and good information. It is possible, regardless of what you hear or what the medical establishment will tell you, and I, as a nurse, actually had a hard time wrapping my head around this for a long time. It is possible for your body to heal, provided you remove the things that actually cause the damage, replace the nutrients that your body is so desperately looking for, and heal the inflammation. Once your intestines are healed and your inflammation is gone, then your immune system can work appropriately and not actually attack your own body, and actually just attack the things that should be taken care of. T-cell mediated antibody responses need to be addressed appropriately, and typically it's with a diet change for some people, not for everybody. So when we talk about autoimmune issues, what are we talking about? Now, I talked about the ones that I know I had. There was a couple more, but you get the idea. That's enough, huh? The other thing I think is interesting for myself is that every day I talk about celiac disease, I talk to somebody somewhere about gluten intolerance or celiac disease, and I'm kind of a little shocked at how little people actually still know about gluten intolerance or celiac disease, even in my circle of friends. I talked to a guy yesterday, and we went out and had tea. We talked about some other media ideas, and he said, "I don't even know what a paleo diet is. I thought it was some kind of diet thing, to lose weight or whatnot." Like, well, some people do lose weight. It just depends. But I want to review basically, what a autoimmune disease is. What does that entail? So again, it's your body attacking itself. And this is a review of some of the autoimmune issues that can pop up. And what would those autoimmune diseases be? So, celiac disease and associated autoimmune diseases. And this will be referenced in the podcast notes, so take a look over there. Liver diseases, primary biliary cirrhosis of the liver, autoimmune hepatitis, primary sclerosing hepatitis. And please keep in mind that I see a lot of patients with all of these autoimmune diseases every day. Type 1 diabetes or insulin-dependent diabetes, autoimmune thyroiditis or autoimmune thyroid disease, and Addison's disease. Did you know that JFK is looked at as possibly having celiac disease? It hasn't been proven yet to my knowledge, but he had Addison's disease. He always had lifelong intestinal issues. Addison's disease gives people that year-long looking tan skin. And the reality is that's a thyroid disorder. So Maybe we'll do an entire episode on JFK and the Kennedy family potentially having celiac disease. They are all Irish. Dermatologic issues include dermatitis herpetiformis, and stay tuned for next episode because that episode will be on all of the skin issues associated with celiac disease. Alopecia areata, again, that loss of hair. Vitiligo. Do you know what vitiligo is? Most people are familiar with the fact that Michael Jackson had what's called vitiligo. It's an autoimmune disease, and what it does is it takes out all of the melanin underneath your skin, so people end up with white patches. White people can have vitiligo, but it's much more evident on people of color, so people from like African American people or Hispanic American people or worldwide, anybody with darker skin can have vitiligo, and it's much more readily seen in people that have darker skin, but you can actually reverse it. I wish I would have gotten a hold of Michael Jackson before he died, as far as being able to potentially get him on a gluten-free diet. Wouldn't that have been interesting to see if we could have made that vitiligo go away? Did he have vitiligo? I don't know. But it is a real medical concern because it is an autoimmune issue. Neurological issues such as gluten ataxia. This is where your brain actually attacks itself. So your body actually produces antibodies that attack your brain. That is not a good idea. Peripheral neuropathies or numbness and tingling in your hands and feet. Any rheumatological or connective tissue diseases. So that could be rheumatoid arthritis, juvenile rheumatoid arthritis, or juvenile idiopathic arthritis. And idiopathic means, it's a medical word that means we don't know what causes it. But if we find out that gluten intolerance or celiac disease cause it, guess what? We know what causes it at that point. It ceases to be idiopathic. Then there's Sjogren syndrome, which of course we talked about very early on, something that I myself had symptoms of. Dry eyes, dry mucous membranes that eventually turn into organs that are rocks. Hard for your heart to beat if it's actually a rock. Systemic lupus erythematosus, which is SLE, also associated with a butterfly rash around the face. Typically in women, it gets diagnosed more than in men. I would add also Ehlers-Danlos, which is a connective tissue autoimmune issue where people have hyperreflexive joints. They can bend their arms or pop out their joints. That's not a good idea. So we may not be able to undo the damage that's already been done, but it's always a good idea to stop the progression of any of these diseases if at all possible. So if you can do that with the diet change, by all means, feel empowered to try that because sometimes it just works. This issue came up a couple weeks ago. Somebody came into my office and said that their brother actually had dilated cardiomyopathy. If that cardiomyopathy is associated with celiac disease, then you can undo the enlarged heart damage and reverse the cardiomyopathy. It's been done many times worldwide. You can look up those studies yourself. And we can have an entire episode also on the heart muscle itself and why it's so important to consider a gluten-free diet if you have any heart arrhythmia or any heart issue. Pericarditis, autoimmune pericarditis is in here. The interesting thing I find as an emergency room nurse is that we never checked a magnesium RBC level on any of our cardiac patients. Keep in mind that in order for a muscle to contract appropriately and effectively, there has to be the correct levels of magnesium and calcium in those muscle fibers. So if you're actually deficient in magnesium or calcium or both, or there's a imbalance, then your muscles have a hard time beating correctly. So that may be the cause of a lot of the heart arrhythmias that we see in the emergency department. AFib, A-flutter, PSVT, some of them quite lethal, which would be VTAC. So we want to actually test for magnesium RBCs to make sure that that magnesium level is appropriate in the cell. I don't really care how much magnesium you have in your serum, which is the blood. I want to know how much you have in the actual cell itself. So I want to see a magnesium RBC. Most people haven't had that done, unfortunately. And it would probably be a very good thing for every American to have tested. And again, that's a magnesium RBC level. So dilated cardiomyopathy is a big deal. When this person came in, they, basically what we do is with people that have cardiomyopathy at this point in this country is we wait until it gets bad enough, and then we put them on the transplant list, and then they get a heart transplant. That's a big deal. So medically, that's not a good thing. So I highly recommend that anybody with any cardiac issue most assuredly get tested and tested appropriately for celiac disease. And even if the test comes back negative, please consider changing your diet. At least going on a gluten-free diet, gluten-free, dairy-free at the very least, and then also kicking it up with some version of a paleo diet. The very basis of a paleo diet is always going to be gluten-free and dairy-free, further taking out any grains and further taking out legumes, which are peanuts and beans. There's reasons for that. Other associated autoimmune diseases would be things like psoriasis. Again, that is not a topical skin issue. It is a deep tissue issue. Sarcoidosis, autoimmune thrombocytopenic purpura, ITP is what we call it for short. It's when your body doesn't produce enough platelets and your blood doesn't clot, so you end up with a lot of bruising. And if you do get cut, it's very difficult to stop that bleeding. And it's also, you can have internal bleeding or GI bleeding, which is gastrointestinal bleeding. Pancreatitis, in the absence of alcoholism, anytime it's diagnosed, it needs to be investigated to see if celiac disease is actually the primary cause of that pancreatitis. Microscopic colitis, enteropathic associated T-cell lymphoma. Again, all of these things are, we'd like to avoid them. I like to think that I'm dodging these bullets every day by being on a very clean, wholesome, organic, local diet. Food is my medicine at this point, and I treat it as such so that my body can continue to get healed. And, quite frankly, 10 years on a very least gluten-free, dairy-free diet, 10 years later, and I'm still healing. It takes at least 6 months to a year for your intestines to regenerate. And then who knows how long for the inflammation to go away. Then we have to rebuild the microbiome. There's so many variables in this. It's kind of fun. It's very intriguing and fascinating how we can actually work to help our body get better. So another interesting thing that came across my radar quite a while ago was NASH. Now, some of you aren't going to be familiar with NASH, but NASH actually stands for non-alcoholic steatohepatitis, or non-alcoholic fatty liver disease, which is NAFLD. I like NASH better. I mean, I don't like either one of them, but I like NASH is a quick and easy way to say it. So again, non-alcoholic fatty liver disease. This is when the liver actually has fat deposits in it, and it doesn't show up on lab tests. It's very difficult to test for. It doesn't even show up on ultrasound sometimes. Typically, people would need to have a liver biopsy. And the most frightening thing for me as a nurse about this was that I first heard about it several years ago when I was getting my BSN and I was scanning some of the resources, and I came across a conference from a pediatrician on the East Coast, a pediatrician on the West Coast, and a doctor from Italy. And they were discussing NASH. And basically what they were saying is that they were concerned and they were having this conference because they were finding NASH on children during autopsy. NASH actually potentially can kill people, children also, and there's no signs or symptoms, and it's very difficult to test for. Most people don't go to their pediatrician and get a liver biopsy. That's just not how that happens. So ideally, what we're going to do is prevent NASH, or non-alcoholic fatty liver disease, both in children and in adults. So Wilson's disease, and this came up as an interesting conversation piece because I had been talking about Williams disease and they got misinterpreted into Wilson's disease. And so Williams disease is a genetic anomaly. Down syndrome, Turner syndrome, and Williams syndrome children or adults all need to be tested for celiac disease because they have it at a higher rate than other people. But then Wilson's disease it's another issue. It's also confirmed to have an association with people with celiac disease. Let me just read this one. Abnormalities in copper metabolism in celiac disease with copper uptake from the gut and levels in urine higher than in healthy controls have been reported. So it's a issue with the liver and the fact that copper can't be utilized. And it's a trace mineral that is very important actually to your neurological system. Did you know, and I'm going to repeat this several times, that just about in potentially every type 1 diabetic is either a HLA-DQ2 or HLA-DQ8 gene carrier? That's how enormous the genetic overlap is. So there's a couple studies that were done, and basically Scotland did a research article to find out how many people with type 1 diabetes actually were gene carriers for HLA-DQ2, DQ8, because we knew that the genetic overlap was enormous. And so what they did was they did this huge study on these kids, and they found out that 94% were DQ2 or DQ8 positive. So that's enormous. And then a follow-up study actually found that the remaining people actually were DQ2.2 positive. And interestingly enough, people that carry the DQ2.2 gene are considered to be at low risk for celiac disease. But here we have them making up the remaining component of people that are HLA DQ2, DQ8 positive. So almost 100% or potentially 100% of the people that are type 1 diabetics are also gene carriers for celiac disease. We knew that genetic overlap was enormous, but it quite frankly is potentially 100% that genetic overlap. So if we were able to find out at birth if a person was DQ2 or DQ8 positive, then potentially they would have the option to go on a gluten-free diet and potentially prevent themselves from developing any of these other autoimmune diseases, including type 1 diabetes. That's a huge deal. That is large. This is not a small thing. So if we can prevent people from actually suffering, then that's a good thing. So I'm going to wrap that up. That's a lot of information very quickly, and I threw out a lot of medical terms today, a lot of big autoimmune terms that some of you may or may not be familiar with. If you have any questions, please feel free to call me or text me, email at Nadine at glutenfreern.com. You can always leave a comment on iTunes or Stitcher or Google Player. I love feedback, and thank you very much for those of you that have actually sent in reviews of the Gluten Free RN podcast. I really, really appreciate it. And if you do like this show, please write a review. Tell people, spread it around, share the love, and share the information because people really have to know this. And what I'm finding is that even today, even 11 years after I've been doing this, pretty much full time, there's still a lot of work to be done and still a lot of people to reach because not everybody has the same information. And I really do want people to be educated so they can make informed decisions about their health. So thank you once again for joining me, the Gluten Free RN. We're wrapping up episode 10 on autoimmune issues. And stay tuned because next episode is on the skin.